ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, ਸਵਾਗਤ ਹੈ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਹੈਡਲਾਈਨ ਕੈਨੇਡਾ ਦੀ ਅੱਜ ਦੀ ਇਸ ਖਾਸ ਪੇਸ਼ਕਸ਼ ਦੇ ਵਿੱਚ। ਟੋਰਾਂਟੋ ਤੋਂ ਮੈਂ ਹਾਂ ਜਸਲੀਨ ਕੌਰ। ਸ਼ੁਰੂਆਤ ਕਰਦੇ ਹਾਂ ਅੱਜ ਦੇ ਐਪੀਸੋਡ ਦੀ। ਕੈਨੇਡੀਅਨ ਕੰਪਨੀ ਡਰਾਈਵਰ ਚੈੱਕ ਵੱਲੋਂ ਕੋਵਿਡ-19 ਟੈਸਟਿੰਗ ਨੂੰ ਐਕਸਪੈਂਡ ਕਰਦਿਆਂ ਕੋਵਿਡ ਡਿਟੈਕਟ ਹੋਮ ਟੈਸਟ ਕਿਟ ਲਾਂਚ ਕੀਤੀ ਗਈ ਹੈ, ਜਿਸ ਨਾਲ ਹੁਣ ਕੈਨੇਡੀਅਨਸ ਘਰ ਬੈਠੇ ਹੀ ਆਪਣਾ ਟੈਸਟ ਕਰ ਸਕਦੇ ਹਨ। ਇਸ ਸੰਬੰਧੀ ਵਿਸਤਾਰ ਦੇ ਵਿੱਚ ਗੱਲਬਾਤ ਲਈ ਸਾਡੇ ਨਾਲ ਲਾਈਨ ਤੇ ਹਾਜ਼ਰ ਹਨ ਡਾਕਟਰ ਜੋਨਾਥਨ ਡੇਵਿਡਸ, ਜੋ ਪਿਛਲੇ ਕਈ ਸਾਲਾਂ ਤੋਂ ਡਰਾਈਵਰ ਚੈੱਕ ਦੇ ਨਾਲ ਕੰਮ ਕਰ ਰਹੇ ਹਨ ਅਤੇ ਇਹਨਾਂ ਨੇ ਪੈਂਡੈਮਿਕ ਦੌਰਾਨ ਕਈ ਕੋਵਿਡ-19 ਟੈਸਟ ਵੀ ਕੀਤੇ ਹਨ। Hello, Dr. Jonathan Davids. Very warm welcome to PTC Punjabi. Thank you for your time.
Thank you for having me.
Dr. David, as we know that COVID-19 has created a very difficult environment for businesses, employers and employees, and vaccination and COVID-19 testing plays very important role in detecting the virus and protecting others. So we know that recently DriverCheck has introduced COVID detect home test kits. So I would like to ask you how helpful this kit will be.
Sure. As you know, Jasleen, we have a press on from a number of different organizations who want their employees to be tested if they're not vaccinated. And so they have a vaccination or a test policy. COVID Detect is a web-based system that allows organizations to include any number of their workers to get tested. They sign up for COVID Detect. We send the workers the kits as the organization wants us to. The organizers are then able to manage their test results as their workers are taking their tests wherever they happen to be, whether it be at home or another location. The workers upload their test results, and then the organization administrators can manage those test results so they can permit people who are safe and unaffected back into the workplace while keeping anyone who tests positive out of the workplace, thus keeping their workplaces safe as well.
So how long does this kit take to give the result, and how accurate the result could be?
Yeah, another good question. So COVID Detect utilizes Health Canada approved testing kits. So these are rapid antigen testing kits. It takes about 15 minutes for us to get the results. The whole process from actually getting a sample to testing takes between 20 to 30 minutes. So you do have a result pretty quickly. And then the accuracy of these test kits are again, these are Health Canada approved test kits, so they're very accurate. They've been utilized over the past several months. These are not quite as accurate as the lab-based PCR test kits are, but certainly the rapid antigen test kits that have been pushed out by government programs in a number of provinces utilize the same ones that we're using. So quite accurate if you get a positive test. It's over 98% accurate that positive test is a true positive. If you get a false test, or if you get a negative test, the likelihood is there's about a 75 to 78% chance that that's actually accurate. So this is keeping in line with all the Health Canada kits that have been pushed out already. We're using the same ones.
So usually we see that people go out to the hospitals or clinic for the testing. So talking about this home test kit, does the interior nasal testing require a supervision of a medical health professional?
Yeah, so the answer is no. You don't need a trained medical professional to actually take a sample and conduct the test. The tests are relatively easy to do. With some instruction, individuals are able to do this themselves. So it's self-collection. They're able to perform the test, the sampling themselves, and then perform the test right after, immediately after they take the sample, pretty easily. And like I said, it takes about 20 to 30 minutes for that whole process to occur. So pretty easy, pretty convenient for people to do this at any location. While individuals go to the hospital or to an assessment center, those tests that are sent to the lab do require a healthcare professional. It does require a little bit more of an invasive test right to the back of the nose. The tests that we're using at COVID Detect, because they're rapid antigen testing, don't require that level of expertise, and anyone can be trained to do this quite proficiently.
Dr. David, we know that there are many other COVID-19 tests out there. So can you tell us how many coronavirus tests are available and how they are different and how do they help?
Yeah, sure. There are basically three broad classes of coronavirus testing. Certainly, I talked about the lab-based PCR testing. This is the test that's pretty familiar to most people. This is what public health has been using throughout the pandemic. It does require a nasal swab back in the back part of the nose. It's conducted by a trained healthcare professional. That test result or that sample is then sent to a lab, and the lab has to process that, requiring analyzers that are pretty expensive and lab technicians and technologists that are able to work those devices. It takes about 1 to 4 days on average, depending on the volume that that lab has, to process that test result. The other type of test results is the one that we're using with COVID Detect, the rapid antigen test kits. They don't require dedicated healthcare professional to sample. It requires some instruction by the person to collect their own sample and conduct the test. It's relatively quick, within 20 to 30 minutes, just as accurate if we have any positive results as the lab tests are, slightly less accurate if we have a negative test. And then the third category is our blood tests. They're called serology tests. They're typically not beneficial for identifying infections right now. They are utilized perhaps in some populations to know if somebody had been tested positive in the previous past. So those don't have a whole lot of utility right now in determining current infection. The two types that we're looking at are the lab-based PCR test, or even sometimes we have a portable PCR, but it's the same technology that's used in the lab versus the rapid antigen testing that we're using with COVID Detect. That's relatively easy to use anywhere that you need to.
These days, we are also seeing that health authorities are concerned about the flu cases as well. Many cases have already been reported. So how the testing can tell the difference between a common cold, the flu, or the COVID-19?
Yeah, so these kits that are Health Canada approved are only for COVID. So they don't test for flu, they don't test for any other viral respiratory illnesses. The way that that might help, though, is that if you are having symptoms or if you're unwell, it's really hard to know whether it's COVID or not. Public health has recommended if you have symptoms, you really should be going out and getting tested through the public health testing centers. If you're not symptomatic, the way that this COVID test can help is it can determine whether or not you have COVID or not. And if you get a negative test, in a day or so you start developing symptoms, the likelihood is that you don't have COVID, but it can't tell you specifically that it's a flu or another respiratory illness. And so you might actually have to be tested if you develop symptoms with specific lab-based testing.
So coming back to the COVID Detect home test kits, are these kits available across Canada or only in selected provinces, and how much do they cost?
So they are only available in selected provinces because of regulations in those provinces that prevent us from getting it out everywhere. We are working with provincial authorities to make this available broadly across the country. The cost of these kits really depend on the volume of kits that organizations purchase and how often people are testing. So if you're testing once a week, there's different cost to it. If you're testing 3 times a week, there's obviously an increased cost to that. If organizations are interested in this, they can direct themselves to coviddetect.ca. It's got information on pricing and how to order these kits for your organization over there.
Are these test kits also valid for international travel?
So depending on the country that people visit, rapid antigen testing kits can be used. Some countries require lab-based PCR tests, while other countries have authorized rapid antigen testing kit results for that. So if you're traveling to a country where this is acceptable, you can certainly use rapid antigen testing kits for that purpose.
How can people order these?
So again, if I can direct people to coviddetect.ca, we have a business-to-business solution. We also have a business-to-consumer solution that's coming soon. You're able to reach out to that website, and you are able to order our kits through that process.
Dr. David, we know that most of the people are following health guidelines, but what advice do you have for people over 50 or 60? And what do you think, what else is needed to end the COVID-19 crisis?
Yeah, it's a very good question. Listen, I think nothing is going to replace vaccination, so it's an appeal to all your audience that if you haven't already, vaccinations have certainly brought us, quite far out of the pandemic. We're still not there yet. We still need a lot more people to be immune for us to get to the point where we are all protected. But if people are unable to be vaccinated, then rapid antigen testing has a role to play. It certainly will provide some information in preventing people from going out into the workplace and unwittingly spreading this if they don't have symptoms but are still infected. I think it takes a concerted effort from all of us to pay attention to ongoing public health needs, to keep up with our masking, to keep up with our distancing. We're still in a global pandemic. We're not out of the woods just yet. So every effort helps. So if you can, please get vaccinated right away. If you can't get vaccinated for some reason, rapid antigen testing will help get us to the point where we are not unwittingly spreading this disease. And certainly keep up with your masking and your distancing and all the other public health measures, like washing your hands and staying away from crowded areas as much as you're able to.
Absolutely. Thank you, Dr. Jonathan Davids, for joining PTC Punjabi and for sharing all your information with our viewers. Thank you and have a good day.
Thank you for having me.
Pleasure. ਸੋ ਹੈਡਲਾਈਨ ਕੈਨੇਡਾ ਵਿੱਚ ਫਿਲਹਾਲ ਸਮਾਂ ਹੋ ਗਿਆ ਇੱਕ ਛੋਟੀ ਜਿਹੀ ਬ੍ਰੇਕ ਦਾ। ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਵੀ ਸਾਡੀ ਇਹ ਖਾਸ ਪੇਸ਼ਕਸ਼ ਇਸੇ ਤਰ੍ਹਾਂ ਜਾਰੀ ਰਹੇਗੀ। ਜਲਦ ਹਾਜ਼ਰ ਹੁੰਦੇ ਹਾਂ। ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਇੱਕ ਵਾਰੀ ਫਿਰ ਤੋਂ ਸਵਾਗਤ ਹੈ। ਸਸਕੈਚੁਅਨ ਦੇ ਪ੍ਰੀਮੀਅਰ ਸਕਾਟ ਮੋਰ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਉਹਨਾਂ ਵੱਲੋਂ ਹੋਰ ਕੋਵਿਡ-19 ਰਿਸਟ੍ਰਿਕਸ਼ਨਸ ਨਹੀਂ ਲਿਆਂਦੀਆਂ ਜਾਣਗੀਆਂ ਕਿਉਂਕਿ ਇਸ ਨਾਲ ਲੋਕਾਂ ਦੀ ਨਿੱਜੀ ਆਜ਼ਾਦੀ ਖੋਹ ਲਈ ਜਾਂਦੀ ਹੈ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਇਸ ਵੇਲੇ ਕੋਵਿਡ-19 ਵੈਕਸੀਨਸ ਹਰ ਪਾਸੇ ਉਪਲਬਧ ਹਨ ਅਤੇ ਇਸ ਕਰਕੇ ਉਹਨਾਂ ਦੀ ਸਰਕਾਰ ਵੱਲੋਂ ਲਾਕਡਾਊਨਸ ਨਹੀਂ ਲਗਾਏ ਜਾਣਗੇ ਤੇ ਨਾਲ ਹੀ ਕੋਈ ਰਿਸਟ੍ਰਿਕਸ਼ਨਸ ਲਗਾਈਆਂ ਜਾਣਗੀਆਂ ਕਿਉਂਕਿ ਇਸ ਨਾਲ ਕਾਰੋਬਾਰ ਤੇ ਅਸਰ ਪੈਂਦਾ ਹੈ ਤੇ ਕਾਰੋਬਾਰ ਬੰਦ ਹੋ ਸਕਦੇ ਹਨ ਜਿਸ ਨਾਲ ਸੂਬੇ ਦੀ ਇਕਨੋਮੀ ਉੱਤੇ ਵੀ ਮਾੜਾ ਪ੍ਰਭਾਵ ਪੈਂਦਾ ਹੈ।
The fact is the number of active COVID cases and the new cases have been falling over the course of the past number of weeks, and that is encouraging for us to see. But our case count in Saskatchewan still does remain high, and that is due to our vaccination rate not being high enough in this province. Most days, when we do the daily case counts, and they're lower today again, but when we do the daily case counts, 75 to 80% of the new cases and hospitalizations are in those that are not vaccinated. Even though vaccinated residents make up the largest proportion of our society, we still have an inordinate number of people in our hospitals and that have COVID that are not vaccinated. And that is why, that large proportion of people that are vaccinated is why we have resisted calls from many to impose more widespread restrictions, to impose potentially lockdowns and ultimately business closures, because we don't think it's fair and we don't think it's right to impose those sweeping closures, those sweeping restrictions on all of the people when the vast majority of people in this province have went out and done the right thing and they have received their vaccine. In the early days of the pandemic, we didn't have that opportunity. The only tool that we had to address COVID-19 was broad-based restrictions across communities in Saskatchewan. But now with vaccines widely available in every community, in every corner in this province, it doesn't make sense to restrict everyone's activities and take away ultimately their personal freedoms. Instead, we have chosen to focus those restrictions on those that have chosen not to be vaccinated through that proof of vaccination system that we have in place. And I know many of you are checking not only your employees, but your patrons as well. And for that, I say thank you. It hasn't been easy, but I say thank you for the effort that you have made, and I'm here to tell you that it's making a difference. It's making a significant difference. It's causing more people to make that choice to go out and get vaccinated. Since we made that announcement in the middle of September, we're up 7% in the province on our first and second doses, a significant increase from where we were in the weeks leading up to that.
ਤੇ ਹੁਣ ਗੱਲ ਕਰਾਂਗੇ ਓਨਟਾਰੀਓ ਦੀ। ਓਨਟਾਰੀਓ ਭਰ ਦੇ ਵਿੱਚ ਰੋਜ਼ਾਨਾ ਕਰੋਨਾ ਵਾਇਰਸ ਦੇ 400 ਦੇ ਕਰੀਬ ਕੇਸਿਸ ਦਰਜ ਕੀਤੇ ਜਾ ਰਹੇ ਹਨ। ਦੱਸ ਦਈਏ ਕਿ ਓਨਟਾਰੀਓ ਦੇ ਵਿੱਚ ਇਸ ਵੇਲੇ 88% ਲੋਕੀ ਪਹਿਲੀ ਡੋਜ਼ ਦੇ ਨਾਲ ਵੈਕਸੀਨੇਟਡ ਹਨ ਅਤੇ 84% ਦੇ ਕਰੀਬ ਪੋਪੂਲੇਸ਼ਨ ਡਬਲ ਡੋਜ਼ ਦੇ ਨਾਲ ਵੈਕਸੀਨੇਟਡ ਹੈ। ਦੱਸ ਦਈਏ ਕਿ ਓਨਟਾਰੀਓ ਸਰਕਾਰ ਵੱਲੋਂ ਪਰੇਡਸ ਅਤੇ ਮੈਮੋਰੀਅਲ ਸਰਵਿਸਿਜ਼ ਵਰਗੇ ਇਵੈਂਟਸ ਲਈ ਕੈਪੈਸਿਟੀ ਲਿਮਿਟ ਹਟਾ ਦਿੱਤੀ ਗਈ ਹੈ, ਪਰ ਜਿੱਥੇ ਫਿਜ਼ੀਕਲ ਡਿਸਟੈਂਸਿੰਗ ਮੁਮਕਿਨ ਨਹੀਂ ਹੈ ਉੱਥੇ ਮਾਸਕ ਦੀ ਵਰਤੋਂ ਲਾਜ਼ਮੀ ਹੋਏਗੀ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਸਰਕਾਰ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਫਿਲਹਾਲ ਸੋਸ਼ਲ ਆਊਟਡੋਰ ਗੈਦਰਿੰਗਸ ਦੇ ਲਈ ਕੈਪੈਸਿਟੀ ਲਿਮਿਟ 100 ਲੋਕਾਂ ਦੀ ਹੀ ਰੱਖੀ ਗਈ ਹੈ।
I want to again thank Ontarians for their collective efforts in reducing COVID-19 transmission by adhering to public health measures and embracing the COVID-19 vaccine. These efforts have allowed us to release a plan that continues the safe reopening of Ontario by gradually lifting remaining public health and workplace safety measures over the next several months. The plan is to slowly and incrementally lift the measures while providing us with time to monitor the impacts on our hospitals and communities. And in the absence of any concerning trends like increases in hospitalizations or impact on our intensive care units, Ontario will continue to move forward. There's no question that the months ahead will require increased vigilance for each of us as we do our part across our province as we move in the right direction. We can't take our hard-fought progress for granted. We must stay cautious, disciplined, and never underestimate this virus. Together, we want to continue taking the small steps forward and not backwards.
ਸੋ ਹੈਡਲਾਈਨ ਕੈਨੇਡਾ ਵਿੱਚ ਐਸੀ ਸਾਡੀ ਅੱਜ ਦੀ ਖਾਸ ਪੇਸ਼ਕਸ਼। ਜੇ ਤੁਹਾਡਾ ਕੋਈ ਸਵਾਲ ਹੈ ਜਾਂ ਫਿਰ ਆਪਣਾ ਕੋਈ ਵਿਚਾਰ ਤੁਸੀਂ ਸਾਡੇ ਨਾਲ ਸਾਂਝਾ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ ਤੇ ਸਾਨੂੰ ਜ਼ਰੂਰ ਲਿਖ ਕੇ ਭੇਜੋ feedback@ptcnetwork.com ਤੇ। ਮਿਲਾਂਗੇ ਅਗਲੇ ਹਫਤੇ, ਉਦੋਂ ਤੱਕ ਲਈ ਮੈਨੂੰ ਦਿਓ ਇਜਾਜ਼ਤ ਤੇ ਦੇਸ਼ ਦੁਨੀਆ ਦੀਆਂ ਖਬਰਾਂ ਲਈ ਤੁਸੀਂ ਬਣੇ ਰਹੋ PTC ਨਿਊਜ਼ ਦੇ ਨਾਲ।